Okay, everyone. What we're going to do is we're going to, I know you're all ignoring me, but you're vaguely listening at the same time. As I say, we do need to stop if we're going to get the feedback. So I'm going to start by asking the wonderful Janet so what we're going to do is we're going to go round each table. Okay, everyone. The portcullis is down. The conversation is at an end. We'll now bring it back to everyone to talk through. So, Janet, are you going to feedback or?
Yes.
Okay, so why don't you come up here? Okay, everyone, we are in official feedback mode. That means everyone has to be quiet. Everyone has to listen.
I'm not either Judith or Hillary or somebody. Yes.
Oh, hold on. Right. Is everyone back with us? Okay, hold on. We got 10 seconds before everyone finishes their conversation then. Okay.
Okay.
Everyone happy? Everyone stopped?
So we had 5 questions, and I'm going to summarise the answers to those as we had them fairly briefly, and some of the issues that we pulled up then. Current status of insecticide resistance in Africa, clearly growing. We also talked about the status of insecticide resistance outside Africa, because this isn't just an African problem, although there's probably more resistance monitoring goes on and more capacity on the ground in Southeast Asia, for example, than there is in much of Africa, although that's improving within Africa. Implications of resistance. At the moment, we need to be able to differentiate between just resistance that we can see, i.e. there's a genetically inherited characteristic that allows an insect to survive a dose of insecticide that it would not normally have done, and something that is operationally significant, i.e. does that impact on our ability to control malaria? And because that's a multi-step process, it's not easy to answer that question. But that's an absolute key question that needs to be answered. Our best guess at the moment is that some of the resistance, but not all of it that is out there, does impact, and we now have some reasonable tools to be able to monitor that. The third one, how to combat insecticide resistance in countries using the tools that we currently have. So we have the global plan for insecticide resistance management that has been broadly circulated. That is the advice from the community that BCG, under WHO's auspices, pulled together. And I think it's fairly clear there that we are looking to moving towards bi-treated nets, ideally with neither of them having any current insecticide resistance associated, and using rotations and mosaics where that is reasonable. We talked about the evidence base that is there. There is a reasonable evidence base out there for that. That comes not only from public health, but also looking at the agricultural sector where they have similar issues with resistance. I think there's more that could be done, but we have some decent guidelines out there at the moment. And with current tools, I don't see that changing hugely. That has the backing not only of WHO, but I think of industry and academia as well. There aren't huge disagreements there in terms of how we should go about that. Does resistance lead to control failure? I think the answer to that definitively is some resistance will definitely lead to control failure. And the question is, how quickly will it happen within the sort of set? And how quickly will we lose some of the sort of set? But we didn't, to be honest, spend a lot of time on that. We spent more about talking about, well, how do we get new products to the market so that as and when it looks like we're starting to get failure, we have something to replace what we've currently got, because that's the big issue. What are the barriers to innovation? How do we sort those out? How do we make sure that we speed up that process and agree if we're bringing new paradigms to the market for resistance management that those paradigms are accepted? And there was a fair amount of discussion about the WHO pesticide evaluation scheme and the issues that still remains a roadblock in the system to innovation, and that the problems around that roadblock have not yet gone away. There is still quite a lot of work to be done there. We then looked at how countries actually managed resistance and implemented the global plan for insecticide resistance management, because it's fine putting a nice shiny document out there, but the countries actually have to be able to turn that into something real that you can do on the ground. We noted that the Global Fund actually asked the countries for their insecticide resistance management plan, and it's moved from being a tick box to they actually have to specify what they're going to do. But then the problem is, as one of the members of our table said, when people specify what they want to do, it goes to the Global Fund, and the Global Fund says, but we're not a technical body, they've put something down on paper, that must be fine. So there isn't a cross-checking of what's going on. The countries then put in their plan an amount of money to do that, but there's no follow-up to see whether they've done it. And we know that very often that money is not used to actually do the monitoring. So there needs to be a follow-up sort of system there. And there needs to be guidance, because it's fine getting data and saying, great, I've got resistance. What do I do about it? I don't know. Happens very frequently at country level. So we need to get some templates out there that says, this is how you ideally monitor. Here's the kind of results you get. This is the kind of template that you take forward. There are now a couple of country templates. I know one from Zambia. I know one from Equatorial Guinea at the moment that are fully worked through. They are fully supported by scientific monitoring and evaluation within the sort of set. At the moment, there is no mechanism anywhere for putting those generally out in the public domain. And so I've talked to Abraham and a couple of other people about this, but we're still struggling to say, what's the place that you use to get these more generally distributed to the people on the ground who need to develop their own plans in this format? So there are gaps there in the market as we move forward.
Just on that particular point, if there was one organisation, is there one organisation that could take that on, given the current way things are organised, or does it need something very complex collaboration?
If I had the answer to that, I wouldn't be asking the question on the sort of set. I know who needs to get the information.
Yeah, but knowing the current structure, which organisation could take a lead on it, for instance?
I'm going to open that to the floor. Joe?
Well, there's a dilemma here. I'm speaking because Abraham, what the countries say is we're only giving it to WHO. We don't trust anybody but WHO. WHO we trust. Everybody else, we think that they'll steal our data, publish it without us, all that stuff. And, you only need that to happen 1 in 100 times, and the other 99 times would spoil it. So, rightly or wrongly, that's the country's attitude. And at the moment, for WHO to get that capacity, given all the other things that are expected of it, how many of them have we heard just this morning? They've got much too much to do. So that's the dilemma, that's the difficult thing. It'd be nice if somebody else could do it, but if somebody else did it, the countries won't give them the data.
Okay. And Abraham, just in answer to Janet's earlier point about whether WHO can be a sort of bottleneck to innovation, do you have any response to that?
I'm not saying WHO. Okay. I'm being very clear here.
Yeah.
I'm talking about the WHO Pesticide Evaluation Scheme, which is not WHO, but it sits under that umbrella.
Okay, well, I don't care where it sits. It sits under your umbrella. So it's still...
Let me go back to the first point that was being discussed about database. Joe is right that countries were a bit uncomfortable in providing their data to an institution outside of WHO. So we thought when we launched the global plan for insecticide resistance management that we would perhaps identify an institution, and that institution will handle the data on behalf of behalf of WHO for member states, and that didn't really go down very well. So now we are forced to actually mobilize resources so that we collect this data and establish a database at the global level that will provide policy directions and support countries as well. But it really needs a lot of resources because we only need also to support countries in terms of establishing their capacities. Otherwise, the data wouldn't be really up to the mark. Having said that, you asked about the question on the WHO pesticide evaluation scheme is a bottleneck. We are very aware of this particular problem. It doesn't sit under our department, it sits somewhere else in another department. And we have.
Do you ever go and knock on their door?
We do.
And walk in and say, what the hell's going on here?
Yeah, we do. I think that's why the organization has now attempted to establish what is called a vector control advisory group that will help in shortening the process of of assessing a product and eventually getting the product to the market. We hope that with the establishment of this committee, that process will be shortened. Having said that, there are still a lot of questions, like manufacturers are asking us, once that committee has made a recommendation, can we go ahead in selling our product so that we don't have to go through the pesticide evaluation scheme? These are some of the issues that we don't have answers as yet, and perhaps, will be tabled in our next meeting in July, and hopefully we'll be able to address those issues.
We need to move on, but is the problem just that, is it bureaucratic? Is it there are too many layers? Is it that people are divorced from the actual problem and therefore they sit in their room and actually don't know the consequences? What is the block?
Part of it is that in the Global Malaria Department there are 20 professionals, of whom one, and a consultant, are entomologists. Yet 60% of all the money that's spent on malaria control and 90% of the deaths saved by malaria control are entomological.
Okay.
Can I just pick one point
and then we'll move, we need to move on.
Because I think Abraham's right in terms of we need the data, but I think this isn't just about data, it's about data interpretation, and there was 2 steps to this process. And I remember a couple of years ago, the control program manager for Ethiopia happened to be at a meeting with me, and he came up in one coffee break and said, I don't know what I should do. I've got resistance to all 4 classes of insecticide because we've done our WHO bioassays as we're supposed to, and clearly I've lost my vector control. And I just laughed and said, you've got to be joking. You clearly haven't lost your vector control. We can sit down, we can look at your data, we can work out what's important, what's not, and there is still plenty you can do even in that situation. And that's the problem, that there is not only a lack of being able to generate the data, but understanding what data is important, what it means, and then what you can do. And it's almost the more difficult bit is the second bit, not the first bit. So great, let's put the data and the database together, but having a database will still not allow the countries to interpret that.
You should have an annual report.
Okay. No, I'm not going to take any comments or questions because we haven't got time, but have you finished?
I have.
Great. Thank you very much. We're going to go to table 2. Who's going to give the feedback? Come on, and if you can just say who you are and where you're from.
So I'm Richard Allen from the Mentor Initiative, and I come from a very wonderful table with loads of experience. And going from the high-tech science of resistance through to the much higher-tech operational demands of actually getting nets to people who need to sleep under them, we were looking at what does it take to get nets over the top of people who need them, and where are the problems in that, and what are the possible mechanisms. And just looking at the systems of distribution, we had nice captured experience from different countries of methods that have used some form of established health structure and process, whether it be the antenatal clinics that we've heard about a little bit in some of the presentations this morning, whether it be EPI, process of people coming in to have their children vaccinated, whether it be campaigns taken out to the communities to do mass EPI or mass measles vaccination campaigns or polio campaigns, adding nets on to that. We also talked about the disadvantages that those type of excellent access systems give us. Whilst they get numbers of people very readily, they also have a problem, and that is single point, short time contact with the individuals. And that makes it difficult to give enough education about usage and how to maintain nets. And that's just a real disadvantage with large-scale distribution systems. At the health system itself, where people are waiting longer for other services, then the opportunity to pass good education is better. All of those are effectively push systems with recipients who are there. And we also talked about going out to schools and other places where people collect in a way that you know you're getting to the target audience, i.e. children and potentially those who they influence in their families, and the value of school distribution systems, potentially also churches and other places where people gather. All of those have advantages, all of them have disadvantages. Some of them are clear and obvious. They tend to revolve around who goes to those facilities. Not all children go to school. In Angola, only about half the children go, half the children don't. So there are access issues in every country. There are equity issues with the different distribution systems. Then we added on commercial. Joe said this morning we should leave that one alone, really, because it knows how to do business very well in terms of people who sell nets in the marketplaces. They do. They know business much better than people in public health ever will. However, just as we have engaged with the private sector for malaria treatment and are successfully now in multiple countries establishing private sector malaria case management at good quality level with pilot programs across many countries, so too might we explore doing the same thing with good quality nets, creating demand in the commercial sector on the ground, using proper HUPES approved nets to create demand even for people who are paying. We talked about cost. Is cost an issue? Well, it's not really. It hasn't been an issue for a long time because we haven't been charging people for nets for a long time. What we've effectively been doing over the last 10 years is creating a demand, a marketplace without cost. As our funding starts to degenerate, and I think it was Joe that showed us it this morning and others, the funding is going down. We know that. The institutional buyers are buying less and less nets, and they will continue to buy less and less nets as the years go on. All that does is if there are nets in the commercial marketplace locally, good quality nets that we'd want to see and not bad quality ones, it means that people already have a value built up, a net culture built up by the years of mass distributions, and can buy as well as receive for free, even in the same context. Though it helps to know, because in some countries, some people may hold on for a free mass distribution that they perceive is going to happen sometime ahead, rather than go out and buy a replacement net, which might be available immediately. So the conclusion we came to is that there are multiple channels of distributing, all of which have merit. None of these are new. We were doing these all 15 years ago, and we discarded most of them in place of mass distributions. What we're seeing now is that mass distribution is a great way of getting an initial large-scale presence of nets. I won't even use the word usage, but a large-scale presence of nets and a large-scale understanding of nets on the ground. And a multitude of other mechanisms for sustaining that level of distribution, that level of coverage, is needed. And in any one country, a country needs to select the different methods of distribution that might be available to them to keep that up. And it will be different in different countries, from right the way down to community workers with various house-to-house contact services that have nothing to do perhaps with malaria, but onto which nets can be added. So we then talked about another factor, which is about cost, and about if a family is going to have the disruption of needing a net and replacing a net. In some situations, as we know, it might be as often as every year, if a net is not very durable in that setting. In other settings, it might be every 3 years, maybe. It might be 2, it might be 15 months. But there's an economic value as well as a health value as soon as a family only needs to replace a net perhaps every 5 or 6 years, because the disruption to them and the ability to save up for it, obviously there are advantages there. And the perceived value of the net, if it lasts longer, might also well go up, as the amount of times they have to take their children to the hospital or the health facility to have a diagnosis and treatment for an unknown fever go down. So there are values in terms of improving the quality of the nets that we feed into that distribution system in order to build up the value perceived by the families and the real economic and health impacts of having those better quality nets.
Great, thank you. I'm aware it's 3 minutes to 12 and we were going to finish at 12. So is everyone happy just to go over 10 minutes? Everyone still okay? Great, because it'd be great to ask questions in the debate, but I think we haven't got the time. We've just got to do feedback for now, and then at the end we can do any last comments. So, table 3. Great, thank you.
Quite short and sweet.
Yes, but you have to stand up. You can't do it sitting down. I don't know why, but it just seems reasonable.
Okay, we were discussing the role of the commercial sector, and it took us a long time actually to define who the commercial sector are. And with about 10 minutes to go, we actually decided that it was everyone down the value chain and distribution chain from the primary manufacturer of the net. So we excluded the primary manufacturer. So this includes local distributors, local traders, all the way down to the consumer level. To answer the questions of what are the roles of the commercial sector, and indeed how can we get the commercial sector more involved, it did hinge quite a lot on the fact that the commercial sector at present has a big challenge in operating alongside these periodic mass campaigns. As you know, logic would have it that this is not the greatest incentive for a commercial operation when you have large numbers of free nets going into countries on a pretty regular periodic basis. So the local manufacturers, the local traders, the local distributors, etc., we decided really do need to have a bit of a helping hand from the coordinating bodies, that be that the NMCP, local WHO office, etc., to really bring some incentive to them. One way of doing that would be to basically tell the commercial sector when and where the mass campaigns are going to happen, so that they do not duplicate efforts. One of the traditional roles of the commercial sector is to communicate and create awareness, advertise their wares to all intents and purposes. If you are advertising on a limited budget, that is obviously a fixed cost, and then the government bypass you with a big load of nets, total waste of time. So if there could be a coordination there of where nets are going, then the commercial partners would basically be able to better place their advertising and communication and messaging efforts, just so that there's no duplication of roles there between them and the NMCP. I mean, linked into that as well is the fact that nets are quite slow-moving goods. It's not a fast-moving consumer good. People, you know, it's a textile. It's something which is within the bedding kind of milieu. So again, better coordination would help in that instance, because it is not a fast moving consumer good. What else did we say? Aside from the primary manufacturers have not traditionally had much success within the local commercial market, right down to the the village level, and that is perhaps one role that the commercial sector could really focus on. What else? Finally, we highlighted quality assurance as one area that the commercial sector could get involved in, from the local manufacturing perspective. If there was better quality assurance and better product development, then again there might be better local demand.
And just one very quick thing, because the way things have been traditionally structured. You've got the institutions here, you've got the NGOs, you've got the major international corporates, and then you've got the sort of local supply chain, which have all been run separately, often without much to do with each other. I mean, did you talk at all about how can those different parts of the system collaborate more effectively? So you gave one example of communicating when you're going to do handouts, but I would imagine that if you thought of it sort of cross-functionally rather than vertically, that you would come up with all sorts of different solutions, wouldn't you? I mean, is there a sense that actually it is too siloed and actually you need more cross-cutting?
That's my part.
Yes. Yeah. Let's just pause. Sorry.
What I was trying to say.
Yeah.
Currently, it was the point I tried to make in my presentation. Currently, the commercial sector at the moment is made up of the international manufacturers that don't have a retail presence.
Yes.
They are major agribusiness chemical producers. They're not retail consumer companies. So what we tried to make a distinction is a distinction between those people, the large-scale manufacturers of LLINs, who serve the donor institutional market, the vulnerable communities who require bed nets free of charge. And then there's the other private sector that exists in country. And those small-scale manufacturers or cottage industry producers, there needs to be they need to be looked at very differently, because they're the people that have the private sector who have the capacity to reach the retail consumer level.
But the other thing, of course, is you can link those two together, couldn't you? I mean, like companies like consumer goods companies like Unilever work right through the supply chain because they need to work in and they need to work out. They need to get the raw materials out and they need to get the products in. So actually, there are, it might be that actually you need to team those two together.
Well, something we were talking, Anne and I were talking about, is that there are retail specialists like Unilever, Procter & Gamble, who could work with these companies who aren't consumer specialists.
Yeah, because they know
there is a whole industry that currently exists in a local industry, local African industry.
Yeah.
How do we work with them?
And one of the things Joe talked about was give them the yarn and then they'll... Right. Okay, good. God, it's complex. Okay, table 4, who's... Great. You can why don't you come over here so everyone can see you and tell us who you are, where you're from, why you're here, all that sort of stuff.
Well, if I'm sitting down, it doesn't make much difference when I'm standing up. Okay. I'm Sylvia Meek, and I'm from the Malaria Consortium and reporting back on the group about the future of nets. I think the first statement, which was quite unanimous in our group, is that there is a future for nets. People will be glad to hear around this table, this room, I'm sure. But there was quite a lot of discussion about the need for better nets and for stronger nets. And there was also some discussion about some of the messages that we're sending, which can be rather confusing sometimes. For instance, are we now saying that it doesn't matter so much if your net's treated, which is clearly not what we're trying to say, but in the environment where resistance is threatening, then we do really need to start looking a little bit more about what is the value of the net itself as well as the insecticide. I'm afraid that all the points I have more questions than answers, but I think some of them are moving in a direction of things that may have fairly practical endpoints. I think one of the things that came across throughout the discussion was that we really need to find ways to do more to stimulate and incentivize innovation. It came across in a lot of different ways, whether it's how markets work, what the tools, the products, and so on. But what we're lacking at the moment is the way of supporting that. And some of the issues have come up in different groups on that, but it's something that really needs more focus. And then what we did find was that a lot of the areas in terms of the future of nets were areas where we do need to balance very conflicting objectives. All sorts of areas were like that. There was the discussion on universal coverage versus targeting. It's a debate that many of us have been through before, but it's coming back again now, and I think part of it is defining more clearly what we mean by targeting, particularly in an era where transmission patterns are changing and areas where risk was high in the past. Nowadays, in some of those areas, it's getting lower. So there's still quite a lot that needs to be thought of there. The other conflict was the conflict between single interventions and combinations of interventions or multiple interventions. This has become perhaps more emphasized now because of the issue of resistance and thinking about the approaches to drug resistance, where everyone really supports the idea of combination therapies. Should that be the approach that would play a role in insecticide resistance? But even beyond the resistance issues, the idea that more people will access nets or protection from mosquitoes if there are multiple tools and multiple ways is an issue. And then the discussions between the cost of nets and the durability, the cheap versus the high quality spectrum. One of the things that was really important was how to get some of these messages a bit clearer, accepting that we do have some conflicting objectives which we don't have a consensus around, but how can we perhaps more efficiently come to a point where we can actually just get on and do something while waiting for more evidence to be able to resolve some of those issues, and not losing too much time on that. I think there is a risk that will cause confusion if the debate is the end point, and so that could risk a lack of interest. I think overall we did support as a group multiple combination approaches in general, although very much aware of the cost implications of that, and also the evidence gaps in terms of what combinations and the difficulty of actually getting that evidence. I think there clearly has been quite a lot of work on the big question in terms of combination approaches with combining long-lasting nets with indoor residual spraying, and that's a particularly difficult one, and so far the evidence isn't really supporting the added value of having both together, except in areas where there already is some potential impact from resistance. Quite interesting discussions around including more attention to housing design as one of the new methods to focus on. Housing design is changing in many countries, and how can houses be made not only better environments for the life of the mosquito net, but also in terms of keeping out the mosquitoes. And then we were asked to look at tools for outdoor biting mosquitoes and transmission outdoors. And certainly there are some promising options, and it's one of the issues there is a lot of the people who are infected outdoors are people that are quite hard to find themselves, because the fact that they're living outdoors, they're often migrant workers or people that are quite hard to access, but there are tools that are very much worth trying. They tend to be in parts of the world where the malaria burden is actually starting to go down, so that investment in malaria is somewhat threatened, but there are also areas where drug resistance is increasing, so that actually balances out the lack of priority. And then finally we had some discussion about issues of distribution, access to different populations, and health systems strengthening. I think there was a feeling that there was a need to focus a bit more on the constraints for the users. We've done a lot of work on the supply side, but perhaps not as much as we should on the user side. And there was certainly a comment that some of the current financing systems are really not supporting the tailor-made solutions that we need more and more. I think that was it.
Great, thank you very much. I'm aware we have run out of time. But so first of all, I want to thank the Malaria Consortium for hosting this, because I think, some of us will have learned something new, some of us may have not, but some of us hopefully will have met new people, and I think there's a huge value in getting a number of people in a particular area to come together and just spend time with each other and hopefully just share that space and knowledge, and also connect up with each other. So I hope it's been useful. I don't think these things ever change the world, but I think they do sort of offer new perspectives, and I do know that, as I said, I've been looking quite a lot at systems change, and the fact that you can have a group of people sitting in a room and actually come up with new solutions and sort of think about actually new ways that aren't just sort of revolutionary, but actually integrate things that already exist. And I think that's one of the things I've heard this morning, is that we're not trying to create something completely new, but you're saying there's lots of bits of the architecture around, but often they aren't joined up, and you don't have the right people talking to each other. And you have, and that's a classic example, I think, of the major manufacturers not necessarily being linked into the supply chain, not linked into the to the organizations in the way that actually, if they were to come together with more trust in a way that was facilitated well, could actually come up with solutions to problems that in the past weren't there because people were taking a siloed approach. So just want to thank all the speakers, the facilitators, all of you for coming. There's, I think, some food. And also just finally, Sue George over there, who you've all been wondering, what the hell is that woman sitting over there? Is she doing her homework? Well, Sue is doing her homework because she's going to be doing the write-up. So the purpose of these events, from our perspective, is firstly to host a conversation, but also actually to get some of those key points out to the broader public. And also in that regard, I'd like to introduce Eliza, who's over there. And Eliza is the editor of the Global Development Professional Network, who will be hosting the debate and also is supporting all this work and developing that site. So, hello, Eliza. And one of the great things about the networks is actually about getting experts, finding experts who can write for us and who don't normally get the opportunity to get their message out, and so don't all offer Eliza a piece about malaria at the same time, because she'll be overwhelmed, but pass on your contacts if you're interested in writing, because actually, you know, what The Guardian can do, one of the things it can do is take issues that normally don't see the light of day and don't get any sort of mainstream attention and actually give them that attention. That's one of the things we believe The Guardian can and should do. So there's going to be food, but just say thank you, everyone, and thank you, Amanda, for organising it. And Amanda is particularly relevant because she was telling me she suffered from malaria last year and how awful it was. So she has the personal experience of bringing to that. But to everyone, thank you very much, and please stay and network. There's food. We've got the room for another 40 minutes or so. So please hang around, and thank you very much.